Hi there, I'm Robin Puglia, and I would like to introduce you to the Autoimmune Academy, which is a postgraduate professional mentoring and development program that I have put together. First, if you don't know me, let me introduce myself. So again, my name is Robin Puglia. I'm a nutritional therapist and an IFM certified functional medicine practitioner. I do a lot of education and speaking in the UK and also in the US and sometimes in Australia. And I have also been working as a professional mentor for students and also for other nutritional therapists and MDs for probably close to 10 years. I've been in clinical practice for 15 years. My clinical practice really focuses on autoimmune disease, on complex chronic immune-mediated issues, and on celiac disease and gluten-reactive disorders. I have been educating for some of the labs for 11 years. I've been teaching the autoimmune modules for ION, for BCNH, and for the University of North Hampshire for several years. And I love to educate students, but I also really love working with graduates, other nutritional therapists, and MDs. And our peers. I have 3 daughters, and I also have celiac disease, which is part of my story and my journey. So when I am speaking about autoimmune disease or speaking about complex chronic immune-mediated issues, I'm really talking about it from 3 different angles. I work in clinical practice. So as a nutritional therapist and functional medicine practitioner, I'm working to provide care for people who have got complex chronic immune-mediated issues. And I'm talking from the interface, from the real life situation of what do we do to support somebody who has a complex issue. I'm speaking from the perspective of a patient. It took me 19 years to get diagnosed with celiac disease, and I've been through the system from the conventional system to the functional medicine system and with nutritional therapy to support my own health. But also as an educator, I've spent thousands and thousands of hours over the last couple of decades reading the medical literature and, understanding what the science says and how does that translate into what do we do in clinical practice. And I'm also a working mum. So again, from supporting students and supporting other practitioners and supporting clients and patients in my clinical practice, that's also part of it. Being able to really understand how to juggle and how to make interventions practical and achievable when you have other things that you need to consider as well. So I've been doing this for a couple of decades, and essentially the reason that I put the Autoimmune Academy together is because I teach autoimmunity to students. And so I have spent years and years teaching the basics of autoimmune disease. What do you need to know? What are the underlying mechanisms? I'm often given 5 hours, sometimes I'm given 6 or 7 hours. And in that time, I have learned how to teach, how to understand what is an autoimmune disease, what is an antibody, how are foods involved in autoimmunity, how are infections involved in autoimmunity, what's the diet toolkit. But 7 hours or 5 hours is not enough time to really prepare somebody for the realities of working in clinical practice for somebody that has a complex immune-mediated illness. What if somebody has got an autoimmune disease and also allergies, and also atopy, and also an eating disorder? Autoimmunity is not very black and white. And I have learned that from my own clinical experience. I have a very, very deep love for the immune system. And I also have a lot of excitement about autoimmunity and the immune system and teaching what I've learned. I've learned everything the hard way from my own clinical practice. And it makes me really happy to be able to bring that to other practitioners in order to be able to support the people who need it. So what I wanted to do was put together a program that actually prepared practitioners and armed practitioners with the tools that they would need for working with people with autoimmune disease in clinical practice with confidence, so that when things aren't going to plan or when things are not straightforward or you know, that you would know what to do, that you would have resources and tools for dealing with a situation. Okay, so you know that viruses are involved with autoimmune disease, but how do you know if that's relevant to this case or not? So I put together a program that was really designed and very carefully curated. I spent a lot of time thinking about what have I learned and what do I think I need to know. What did I feel like I needed to know that was very difficult for me to find? And where are the shades of gray? And then I've put that together into basically a 12-month program that is designed to really deepen and expand your knowledge and understanding of the complexities of this topic, but also to really elevate your clinical practice. The point of all of this is, what are we doing in clinical practice? What have I learned from my clinical practice? What did I need to know to be a confident and competent practitioner that wasn't taught in the basics of autoimmunity? Um, and and how can I bring that to other practitioners? So, who is this for? My program is for people who are in clinical practice. So, this is not a program for potentially for people who are still studying. I have had a couple of people come through who are in their final year if they themselves have an autoimmune disease. But for the most part, it's for clinical practice. So, new graduate practitioners are welcome, all the way through to people who have been practicing for years or even decades. Who either already specialize in autoimmune disease and complex cases, or are wanting to specialize in autoimmune disease and complex cases, or who are just noticing that there are more and more complex cases in our clinic, in our clinical practice, and want to feel more confident. So I've had people come through the Autoimmune Academy who are working in fertility nutrition, or in women's hormones and women's health, or in sports nutrition, for example, because autoimmunity now affects 1 in 10 people in the UK, and it doesn't really matter what your specialist subject is, you are going to be dealing with autoimmunity. So, I also have had several MDs come through who just are either new to functional medicine or want to understand more about working with autoimmunity and chronic illness in a more holistic and deep dive manner, moving away from the conventional kind of medical framework. And then I've also had several people come through who are practitioners who have an autoimmune disease themselves, or a child or their husband or somebody who has a family member with an autoimmune disease, to learn how to understand and work with this in real life. So the Autoimmune Academy runs from January. It's a 12-month program. Well, it's a 1-year program. It runs from January to November. So it's a year, but we do 10 months. So we have the month of August off, and then we also have the month of December off. And we do 20 live sessions. So it's 2 sessions per calendar month, which are about 3 hours long each. And then additionally, there is 6 extra sessions which are pre-recorded. So you would watch that ahead of the live session. And so in that live session of that week would be the Q&A for the pre-recorded session, and then usually case studies or clinical roundtable in the live session itself. All of the live sessions are recorded. And I have had several people who have gone through the whole program who are completely up to date, who have never been able to attend a live session. So they're uploaded immediately after the session on the same day, so people catch up either over the weekend. And then we have a portal, a practitioner portal. I do this in Circle, not in Facebook. And the portal is also a very busy, very bustling hub where we meet in between sessions. It's where all of the pre-recorded material is. It's where all of the handouts are. And then it's where Q&A is. I'm posting podcasts, or, people ask questions about non-toxic makeup, or other testing, this test versus that test or whatever. All of that exists in the portal. So it's very easy to search if you have a question about testing, or if you have a question about supplements, or if you have um, any of the other conversations that go on in between the live sessions. I also do Q&A in there about your cases. So if you're working on something in clinical practice and you would like my guidance on that, then the portal is where you can get same day responses to things that are going on in clinic. So I'm, mentoring you through the whole year, through your clinical practice, in addition to the live sessions twice a month. So the the whole year is run through the lens of working with a client with an autoimmune or an autoinflammatory disease, and within that, or illness, we do deep dives, right? So we're learning really about autoimmunology, what's going on with the immune system of somebody with an autoimmune disease. That covers all of the different processes of inflammation and anti-inflammatory strategies, allergy, atopy, mast cell activation, and we're really looking at how they intersect, because we need to understand somebody with mast cell and autoimmunity, or allergy and autoimmunity, or immunodeficiency and autoimmunity, because the reality of in clinical practice, we're seeing people that have a lot going on. And if someone has mold illness and MCAS and an autoimmune disease and allergies, and you've learned everything through the lens of an autoimmune disease is like this, and an allergy is like this, and MCAS is like this. But when somebody is presenting with all of those things, how do we unpick that and understand how to support the immune system and how to resolve the immune system dysregulation in real life? So then we're also looking at the infections, viral infections, bacterial infections, polydysbiosis, because we're talking about dysbiosis in the lungs and dysbiosis in the genitourinary tract and dysbiosis in the sinuses, and how to understand the microbiome a little bit more globally than just thinking about the gut. We talk about COVID and the role of COVID in autoimmunity, and long COVID and autoimmunity, and mold illness and the intersection between mold illness and COVID and autoimmune disease. We talk about stress and trauma and psychoneuroimmunology. We do a lot, because we're talking about the real life of clinical practice, on functional and conventional testing. So for everything that we cover, we're thinking about what are the tools that can help us understand this better. This is not a sponsored, I do a lot of education for lab companies, but that's not what this is. This is not a sponsored um, education session. So you are getting honest, unbiased discussions. We're talking about the gray areas of testing, the pros and cons of different testing, how to have a testing toolkit, how to explore tests that you're not familiar with. And all of it is coming, like I said, honest and unbiased. We're also, as a community, contributing. So you're not just getting my clinical experience, but you are also learning from the clinical experience of the other people in the group. We talk a lot about food, so food reactivity testing, which diets. I feel really strongly that there isn't a diet for autoimmune disease. So we'll be talking about things like autoimmune paleo and why that isn't the answer for everybody, but when it is the answer, and how to understand if you're using that one versus keto versus all of the different MS diets, and so on and so forth. So we do a lot on, obviously, the different diets and how to use them as tools in your toolkit, also how to adapt them for different stages in your treatment interventions. We talk about immunomodulatory supplements, and again, this is not a supplement company sponsored education session, so you're not getting a prescriptive, this is what you must always use and why our company is better than the other companies. We're really talking about what are the ingredients, how do you know about doses, why would you choose this one versus that one, and you'll come away with a full toolkit and really understanding how to use it. But we're also working with a group of people who are often on prescription medicines. So we also really spend a lot of time understanding the immunosuppressant meds. We do a session on drug-nutrient interactions for the immunosuppressant meds, and we talk about how to work with anti-inflammatory supplements and immunosuppressant meds, supplements that interact with the liver and immunosuppressant meds. antimicrobials and immunosuppressant meds, all things that you will really need to know in your clinical practice to practice with confidence. We talk about hormones, and being a woman with autoimmune disease, and actually a lot more besides. We cover a lot in the 12 months because it is really everything that you need to know in the detail that you need to know it in your clinical practice. In addition, we do live case study sessions where you submit your cases and I will dissect those live and give you my perspective and my recommendations. I will also be walking you through my own case study, so you will get the opportunity to watch me do an initial consultation, talk about the tests that I am recommending, and put together a treatment program for somebody with a real life clinical case. That's watching me do it in clinic in real life. And we also do something called clinical roundtable. So this is really about clinical practice, and it is an extremely vulnerable and very wonderful couple of sessions that we do throughout the year, where essentially anonymously who everybody in the group has the opportunity to submit something that they are struggling with in their clinical practice. And it can be anything to do with clinical practice, from the bookkeeping, the marketing, how to keep supplement costs down, what to do if things aren't going well, how to deal with a specific, whatever it is, anything that you are struggling with in your clinical practice. You're going to submit it anonymously, and then I am going to submit these to the group, and we are going to circle around and discuss. And so this is an opportunity it is very vulnerable, but it allows everybody in the group to give advice, to talk about what they're doing that works, and to talk about what they're doing that doesn't work. So we are learning from each other. And while it sounds relatively simple, these have been some of our most powerful and popular sessions of the year, because often we are working in individual, one-to-one in clinic, where it's just you and the client, or we have our little group of friends from ION or from school. And so this gives you the opportunity to learn from other people, to also be supporting other people in your community, and to also be heard and supported. We've learned a lot. It has been a very brilliant addition. It wasn't actually part of my original format for the program, and it has been a very, very valuable addition that sort of came up halfway through. I've talked about the portal. We do this in Circle, and you'll have access to Circle for the whole year, plus another 12 months after the program finishes. So you can catch up, you can revisit the information. You don't just get kicked out of the portal once the year finishes. So you have a lot of access to the resources that are available. In addition to me, now I love and am excited about autoimmune disease, but I have also invited a range of guest experts. And the reason for that is I wanted to be able to provide a really wide spectrum of clinical experiences and perspectives, and also expertise to the conversations and to the learning experiences. So these have included Professor Yehuda Schoenfeld, who is one of the leading autoimmunologists. You can see behind me that I have 4 textbooks that were authored and edited by Professor Yehuda Schoenfeld. He has published over 2,000 papers in the medical literature, and he literally has an autoimmune disorder named after him, and he has very kindly agreed to be a guest speaker in this program. Dr. Christy Hughes, who you may know, who is again one of the leading voices in the industry, is a speaker, is one of our special guests. Dr. Chris Bump, who is one of the favorites. You may not have heard of him, but he talks about viruses with our group, and he's got 30 years of clinical practice specializing in viruses. He's as excited about viruses as I am about autoimmunity, and he just brings so much to the table. And then we have people who you may know from the UK: Caroline Sherlock, our very own Tanya Borowski, Debbie Grayson, Kate Nola, Leonie Ash, Alex Manos, who talked about psychedelics and autoimmune disease. Each of these has been an extremely valuable and interesting addition. So it's not just me. We have a really broad range of guest experts who just add so much to the program over the year. I'm very grateful that these people have agreed to be part of it. So that's my take on the program and the reasons that I put it together and the reasons that I'm excited about delivering it and what I hope is valuable. But I would like for you to hear from the people who have been through the program. So it feels weird to read out testimonials, but I want you to hear from the people themselves. This is in all of their own words. So I've loved being part of the Autoimmune Academy. Robin is so knowledgeable working with complex cases, and we've also learnt so much from the guest speakers over the year. Over my last 15 years of clinical practice, I've spent tens of thousands on CPD, and the Autoimmune Academy is one of the best investments in my practice that I've ever made. If you want to work with clients with autoimmune conditions, this academy is a must. The Autoimmune Academy is a fantastic deep dive into how to work with anyone with an autoimmune disease. As an educator, I can't rate Robin more highly. The level of education is advanced, but it's taught in a very clear and eloquent way, as Robin is great at simplifying complex subjects. On a personal level, Robin is insightful, honest, and generous with her time and resources, and it is clear how passionate she is about the topic and sharing her knowledge with others. This is such a brilliant program. It is more than I had hoped for. I can't rate it highly enough, and I hope to continue to learn from Robin and the Autoimmune Academy. Joining the Autoimmune Academy this year has got to be the best decision I have made for my clinical practice and also my own personal understanding of my autoimmune condition. I'm in awe of Robin's brilliant brain and the amount of knowledge and experience that she has poured into this program. The depth of content provided is incredible, and I know that I will continue to revisit these resources going forward. This was a comment that I just copied and pasted from the portal on somebody who was catching up from the replays. Just catching up, what an amazing session. I had so many aha moments, and it now all makes total sense. I can't believe nobody ever explained it this way, not even the labs. Here are some things that people have posted on social media. Such a highlight. This was from Professor Schoenfeld's session. Such a highlight. What an amazing year. Thank you so much. It was so well curated. And then you are like the fairy godmother of speaker and topic curation. I've been doing the IFM annual advanced practice modules concurrently alongside your Autoimmune Academy. My expectation for the advanced practice modules were sky high, but I didn't know what to expect with your academy. And I must tell you that although I've loved the APMs, your sessions bi-monthly have absolutely outsurpassed just how much I thought I could possibly enjoy and grow. You're an absolute force. This was a comment from Dr. Chris Bump's session on viruses. Mind blown. Literally feel like I've just had my brain and the whole concept of viral infection reshuffled like a pack of cards. Thank you so much for making this happen. What a blast. And this is one from Dr. Datis Karazian, geeking out so hard watching Datis Karazian as part of my year's training with Robin Puglia on the Autoimmune Academy. Such a highlight for me. Really grateful to be part of this. So I recently completed the Autoimmune Academy and I found it very beneficial. What sets this program apart is the perfect blend of clinical experience, in-depth research related to the root causes of autoimmunity, and real-life case studies, all delivered in a highly interactive format. The content is extremely comprehensive, covers a wide range of autoimmune conditions in a way that's both detailed and easy to follow. This course has truly enhanced my clinical knowledge, offering insights that I can directly apply to patient care. Whether you're new to the field or looking to deepen your understanding, I highly recommend this course. I have absolutely loved the course, JB 2024. I have been following Robin from afar for a long time and have been inspired by her knowledge and teachings on the immune system and chronic complex illness. It was a wonderful opportunity to be part of her first cohort of the Autoimmune Academy and to be mentored by her directly. The bi-monthly sessions have provided an excellent insight into everything autoimmune, and she has brought a wealth of exceptional doctors and functional medicine practitioners to our sessions. We've also had the opportunity to discuss complex case studies and interventions and learn from Robin's own cases. It's been a wonderful opportunity to meet like-minded practitioners and share ideas in this area. It's been a great year. I've thoroughly enjoyed the Academy and I would highly recommend it. And I think that this one actually really speaks to the community that we've built within the Autoimmune Academy, which you would be part of the existing community, but also as I continue to build year on year, every cohort that comes through is going to be a micro community within the larger community. And I feel really strongly about this, that we need to be working together. And one of to support each other, which is, you know, so necessary in the industry. One of the other testimonials specifically said something about me being generous with my time and with my expertise. And I also want to kind of say that I don't gatekeep anything. If I know it, I will teach it to you. If I learn it, I will give it to you immediately. Like, the whole point of me teaching this is to try to teach you everything that I've learned over 20 years, everything I think you need to know, everything that is coming up, but also as the industry changes, as science changes, for me to be updating you. Let me spend the time. It's my favorite thing to do, is to spend the time learning the literature and then teaching that to you, so that you can be your best in clinical practice and that we can all be up to date. So I'm trying to really create that. Let me, who has spent 20 years learning this subject, teach you everything I know. I won't gatekeep anything. I will be honest with you. And if I don't know it, I will learn it and then bring it back to you. But also let me create this community where we are all doing that for each other as well. If we know something, let's give it to the community. There are so many people with autoimmune disease out there that is overwhelming our practices. So let us also strengthen and lift each other. And I have to tell you that it's such a wonderful community. You know, I've been so inspired and heartened by the group and how much they have been supportive and encouraging and generous with each other as well. So I hope that you will join us and be part of this community so that we can continue to learn, inspire, teach, grow, and support each other as well. So the Autoimmune Academy is the course that health professionals have always needed. I've taken Robin's courses over several years and I've always been impressed by her comprehensive knowledge of the most complex subjects. She manages to break them down and present them in ways that make subjects more accessible to practitioners and easier to explain to clients. I also really like to teach people how I would explain it to a client. Like, here is the science, here is what I would say in my clinical practice. This is the language I would use, here are the sentences that I use. Like, let me empower you with educating your clients and you know, helping you with that side of things as well. Her work with the testing companies has given her extensive experience with a wide range of tests that can also be invaluable for autoimmune clients. She is an inspirational teacher who not only shares her knowledge and experience, but also takes joy in bringing other experts to share their insights into particular aspects of autoimmunity. She has grown our cohort into a community who shares cases, skills, and tools. Am I allowed to call you a joyful geek? Yes, it's my favorite way anybody has ever described me. And all those sound bites are like little jewels. Do you know, I don't feel like oh no, it's the last one. Okay, the Autoimmune Academy is truly invaluable. This program has expanded my knowledge and various guest speakers have brought expertise on the other subjects. Their contributions have kept the content dynamic and engaging, and I also appreciated the opportunity to see other practitioners' protocols along with their approaches to testing and supplement recommendations. All sessions are recorded, the slides and the different additional materials available in the platform, which serves as a valuable resource, offering space for us to ask questions, share information, and support each other. This program has greatly expanded my confidence and competence in supporting clients with autoimmune conditions, and I'm deeply grateful for the insights and guidance provided throughout the course, and I highly recommend it to anyone looking to deepen their expertise in autoimmunity. So look, it's been very weird for me to read about myself in third person like that, but I wanted you to really hear from people who have done the course, what they thought about it and how it has helped them in their own clinical practice. So hopefully, you know, hopefully that has also been interesting and helpful for you to really understand from the practitioner's perspective coming through the program, what it is that people have found valuable and helpful. So the course runs for 12 months. It is $2,000 for the year, for the full year. I do offer 12 monthly payments of £175 per month, which is a £100 discount. No, sorry, I beg your pardon. If you pay upfront, it is 2,000, which is a discount of £100. If you do the payment plan, then it's 175, which works out to be 2,100 over the course of the year. If you sign up before December 1st, there is an additional bonus module. This is my early bird bonus. And the additional module is on the immune system. So it is the background on the immune cells. And there is also Datis Karazian's excellent presentation in there, delivered by him, on understanding the immune system through the lens of blood chemistry. If you are learning about this, so this finishes on the December the 1st. So if you sign up before then you will get the additional bonus module, which is an extra 3.5 hours of content and answers a lot of questions around supporting the immune system in general. Things like, if you take away a food as part of an elimination diet and the person didn't think that they were reacting to the food, and then you add the food back in and now they have big reactions, have you caused a problem by eliminating the food? That is what it's going to feel like to the client. It is feedback that you will be getting often in clinical practice, and in the bonus module I'm going to explain to you what the immune mechanisms behind that are, why you haven't caused a problem, and how to explain this, and also how to rectify it in your clinical practice. So that is one example of something that I cover in the bonus module. There are multiple other things as well to do with red blood cells and platelets, and why you can't fix an immune system problem if somebody has anemia, and a lot like that besides. So there's a lot of value in that bonus module. If you would like more information or you're ready to sign up, this is my website. My website is robinpoulier.com, and on the home page of the website, you can see that there is this button right at the top where it says Learn More. That will take you to the page that has all of the information about the program on it. And you can also sign up through the page. So on that same page is all the info if you wanted to read more. There's also all of the testimonials if you wanted to go and read those through again. There's additional testimonials on there if you wanted to hear from other people that I haven't read out to you, and you can sign up if you would like to jump in. If you want to discuss with me further, if you have any questions, the easiest way to get directly in touch with me is via Instagram. My handle is @RobinPoulier. I'm on Instagram every day, so you can DM me or comment on any of the posts in my feed, and I will reply in real time. You are welcome to DM me. I will reply same day. All right. Thank you so much for your attention. I'm so excited about this program. It is a real labor of love. I've really drawn on 20 years of clinical practice and research and my own life experience to bring it. And I genuinely hope that you will consider joining me for 2025. We start on the 9th of January, so you are welcome to join all the way through until the end of Jan, but I hope that you will sign up before the 1st, so you get the 1st of December, so that you get the additional bonus content. But the cart is open all the way through until the 9th of January. So please do reach out if you have any questions. And I hope to see you inside the program. Thank you so much for your attention.